I saw how sick other pregnant people were getting. All the information coming out showed how safe and effective the vaccine truly is, and I didn't want my toddler to grow up without a mother if I got sick before the vaccine.
I made a decision to get vaccinated while pregnant in my 3rd trimester. Pregnant women should be more worried about the risks of getting COVID-19.
Health experts are urging pregnant women to get vaccinated, but some are still hesitant to do it because of anecdotal evidence about side effects. Here to tackle those concerns and so much more are Dr. Ileana Castillo, who is co-leading a national team studying COVID-19 in pregnant women, and Dr. Caitlin Dunn, the co-director of the Pacific Center for Reproductive Medicine. Hello to you both.
Hello, Asha.
Dr. Castillo, let's start with you. How has it been determined exactly that the COVID-19 vaccines are safe for pregnant women?
So, Asha, most of the data that we have that is very robust comes from what we call real life data. So at least 150,000 women, mostly in the United States, have got the COVID vaccine during pregnancy. And then researchers have looked at the rates of adverse events in those women who have got the vaccine and have compared those rates against rates of adverse events that were published before the pandemic, and as well against women who have chosen not to get vaccinated during the pandemic.
And Dr. Dunn, you know, a lot of people have fears that the vaccine could cause a miscarriage or damage the placenta. Can you talk me through that?
So this myth started with syncytians. These are natural proteins that occur in our body, and they help cells stick together. Like, for example, when the placenta needs to stick to the uterus in a growing pregnancy. And last year, a blog post claimed that a Pfizer employee was concerned that the COVID vaccine would create antibodies that would attack these syncytians because they're similar to the spike protein on COVID. Now, this is absolutely not true. These myths have been debunked both with looking at laboratory data that show there's no molecular similarity between syncytians and the spike protein, and as well with real world data. Like just this week, the New England Journal of Medicine published a study showing no increased risk of miscarriage in women who got the vaccine before pregnancy or during pregnancy.
Well, it's good to see there is science to back it up, right? Dr. Castillo, what are the risks for unvaccinated pregnant women, you know, if they get COVID-19? And what about the unborn baby as well?
We have very solid evidence to document that COVID-19 infection increases the chances of hospital admission and admission to intensive care unit when we compare the risk that people of the same age that pregnant women would have in comparison. And what we know is that risk with the variants of concern is even worse than the risks that we knew COVID could pose to pregnancy a year ago. For the unborn baby, the biggest consequence is the risk of prematurity that can come with developmental consequences for the babies because they are born too early. And there is emerging research that also knows that even for women who have a very mild COVID infection, the placenta may fail to develop properly.
So it can be a dire situation indeed. Dr. Dunn, we heard from a viewer who wanted to know, is there any evidence that the COVID-19 vaccine can cause infertility?
Yeah, I have heard concerns from my patients and on social media about infertility and about changing periods. And right now, there is no plausible biological mechanism nor any research that suggests that the COVID vaccine causes infertility or that it changes periods with any enduring or harmful consequence. Now, it's important to realize that vaccine manufacturers don't necessarily ask about changes in periods when they do their phase 3 trials. And these are thoughtful questions. Women deserve answers. And fortunately, just this week, the NIH announced funding to study this problem. So we will get more information, but it will take some time.
Yeah, and that's the thing here, right? It's taken months to receive answers on how these vaccines may affect women's health. Dr. Castillo, final question here. What can drug manufacturers do, you think, to give women that peace of mind?
Drug manufacturers and funders, so those that actually give money to the drug manufacturers, like, for example, CEPI, they can change the order in which they do their studies to actually include pregnant women in research. So both drug manufacturers, but very importantly, the funders, need to make it a condition that pregnant patients are included. So when the vaccines are licensed and come out, we can give patients the information they need to make decisions.
Makes a lot of sense. So much worthwhile information. Thank you so much, Dr. Castillo, Dr. Dunn.
Thank you.
My pleasure.